So he's what, 5 months in a week, 5 and a half?
5.5 months.
Okay. So you're exactly the same. When's your birthdays?
He's September 29th.
Okay.
Or no, he's 6 months now.
Oh, 6 months. I was gonna say because she's
She's
Halloween.
Yeah, he was supposed to be born on Halloween.
She was
He was a
supposed
month
to be
early.
born 2 weeks later.
Yeah, he was a month early.
She and my cousin were due on like 2 days apart, and Arlie was 2 weeks early, and their baby was 2 weeks past their due date. So they were a month apart, but the same due date.
So this is Nathan, so I'm just gonna go underneath his shoulder and his pelvis, this shoulder, knocked you over, but I'm gonna bring you back, I'm gonna bring you back. And then I'm just gonna lift his head. So now I'm going to say notice stuff, but I'm different than most therapists. When I talk about notice, I'm already going to start working on changing it. Most people are telling you what's wrong with them, but nobody's telling you what you can do to help them. I totally get it. This child has a large head, but you know, he's not the only one in the world that's had a large head. So notice when I lift the head though, he's reacting, but the response in the back is not there. So his legs are going up and the head's going up, but the back's staying kind of straight. So you can tell cognitively he's actually a very smart baby because he knows what's supposed to happen. It's just not happening. There's a big difference between that and lifting a head and not getting a foot response. Does that make sense? So when I do also too, when I'm coming underneath here, notice he's not counterbalancing. He kind of is just rolling one way. See how I can just knock him over in the whole system, but he's not twisting through his back. And coming back, same thing. So she's 2 weeks older than him, Arlie, but her legs are also down more. I was just talking about it.
Younger.
He wants to, yeah, sorry. She's younger, but her legs are coming down a bit more. He still wants to bring his legs up in spine. Oh, and you're gonna eat me, but you know what, dude? I did notice already, you have teeth, so my hands are not going into that now. Also, what I'm going to show you here is what I was just working on in class. Here, let's turn him around. Since you're an easy one to turn around. What? Huh? Yeah, look at me. Good ducking. So notice, I'm not twisting the pelvis like I was just shown in class. So right here, see, his leg actually wants to go straight into a little bit of a startle. I know. Does that make sense for what we were just... So see, I can twist him. But see how he's organizing, he's trying to go through the chest for it. See how his back's opening up? Just to twist, to give room in a sense for the knee. Instead of just here, see, again, he's starting a little bit. Yeah, there. The counterbalance is not just there. The feet are going in and out, but he's staying pretty symmetrical. So now I'm just going to look at this side. So see, the knee is moving and the foot to the shin, but you're not seeing the pelvis. Does that make sense? Mm-hmm. Yeah? Does it? And with that, now I'm going to get to work. So I'm going to back this up a little bit. I don't know where we are. And then I'm going to talk you through what I'm doing. What I'm doing is, up until now, most practitioners have to do all the work. But I believe with the babies, if you stick with sort of principles that I discovered, that a lot of the parents can do a lot more of the quote, touch and the movement to work with your baby. Just like you'd be changing the diaper. So when I'm going here, again, see the chest isn't twisting, he's just rolling over. Does that make sense? So in other words, see I can't twist the pelvis and his head stays looking up. His whole body wants to turn. Does that make sense? See here it's different? See how he's twisting to look and still looking at me? But if I did it this way, what? So now I'm going to go right to work, like you'll see me do 1,000 times. I'm going to go through his chest. I know. When the breathing and balance and heart function are off, I say this all the time. What? At this point, since I'm working, would you like a ball? Very nice. Does that work for you? You can do two hands? Oh, you're such a big boy. So I'm just going into his chest cavity. A, to work on the function of twisting, but also to work on his breathing. And again, when I say I'm working on his breathing, it doesn't mean he's got pulmonary dysfunction or any of that. But when he goes to turn and stuff, if he holds his breath or does anything that's a little thrown off for the breathing, then he stops the movement. But also what you should start to see is his chest cavity starts to work its way out. Hopefully the feet start coming down a bit. Yes, is that fun? There she is. How are you? Take your time, we're good. Now, if you've noticed, I didn't ask you anything about his history, but Diane will. This is Mason. Mason is just 6 months old. And he goes to the ophthalmologist, what, on the 22nd?
Yeah.
Who's he going again? Have you figured it out?
No.
Okay.
I need to
where it
call.
is?
I don't. The hospital set up the appointment for me.
Oh,
I
okay.
just haven't called.
Okay.
Yeah.
Don't worry, I had recommended Dr. Cassidy, but.
Was this the one you told me about with the, what's it called?
I don't know his diagnosis,
Okay.
or if he even has
But you
one.
think that, okay.
But you're concerned for his vision, right?
Yeah, he has epilepsy, cerebral palsy, and can only see perimeter.
Why?
I don't know.
So that's why
Really?
she's here. Yeah, that's why she's here. She hasn't gone to the ophthalmologist yet.
He stares through you when he looks down the center,
Okay.
which his epileptic doctor's the one that said he's only seeing peripheral.
By the way, he doesn't know, so that's
Yeah.
okay.
But I
Okay,
agree.
so-
She only saw us for 5 minutes.
I know, right? Yeah.
Is that what you, when you're holding him like this, is that what you feel like
Mhm.
he's not looking at you?
Yeah, no, when he's sitting in anything, if I'm not above his head or to the side, he'll hear me
Uh-huh.
and follow me, but he doesn't, you can tell when he sees you.
Yeah, okay.
He's a really miserable, lazy
I
girl,
think I
so.
wanna come over there.
Okay, that's fine.
So, I'm sorry.
I'm being sarcastic when I say that. I mean,
Oh. I didn't.
I just said, he's, to Diane, I said, he's a real miserable baby.
Oh.
Yeah.
He's stubborn. You'll see that when you put him on his stomach.
Notice everything that I'm doing. I'll touch you just so you can feel it.
He hates it.
Well, we'll see.
Arlie hated it until we started coming too. Turned herself into a stick and would scream.
That's what he does.
Bright red, arms at her side.
Well, he flares them out.
She'd put her arms at her side and just go like this and scream and turn red.
Oh, does he have coloboma or something? Right, Ollie? Just hold it.
I have to the flashlight to see.
Okay.
He sees me. He sees
Yeah.
this. He sees this straight on.
No, he's getting better. But his physical therapist said it's him working with his hands, that he's strengthening. I thought I heard that.
Do you need a flashlight?
Oh, you're goofy. You're a goofy.
Well, there's probably one in there, if not.
There's one on my phone.
So.
Hello? Grandma? Hi.
Huh?
Huh?
Do you notice his feet already?
Where is everybody?
See how he's starting to twist more to do something?
He's gonna have
And
an
his feet are
appointment with him.
separated versus being stuck together.
Yeah.
No, this little flashlight in here, I know you usually like better ones.
You want a better one? My phone has a really nice bright one.
Oh, yeah, my phone does. No, this is good.
Okay.
Yeah, thanks. And there's no reason why I can't sit up here, right?
Oh, no. Do you want me to move him?
No. Look at you, look at that.
Now, when we're doing that, notice the flashlight's not going in his eyes. It's going around the orbit of the eye. You never want to point a light into a baby's eyes, or anybody's eyes. I wasn't planning on it, but he seemed to suddenly want to do it, so I figured what the heck.
I was gonna get this, I think this is one. Oh my goodness! Oh, here it is! Here it is! Here it is! Here it is!
Neck muscles are just starting to kick in to bring the head up. There we go. That's it. That's it. Okay. I'll bring you back, I'll bring you back. You haven't breathed in that position yet. You're just learning. Notice again, see, much more now that the legs are starting to come out. You see that?
Down.
There we go. That's it. How many minutes are there? 2.
My other one's 9.
Okay. That's it. That's it. Just check it out. Just get used to breathing. That's okay. You're doing really well. You've never moved your head like that before. It's just different. Yeah?
Oh my goodness! My goodness! Look what I found.
You're the one who keeps doing it. I have nothing to do with this. I don't actually usually mess with heads on the first date, but you keep trying to roll over. And it's okay, you can roll over. It's okay. There we go. That was very nice. That was nice. Yeah. Oh. Oops. There you go. Let those hips come down. That's good job. Good job. Yes. Are you more upset now because you're coming back on your back? Okay. Again, notice there's no tears. But see, he's totally initiating all this rollover,
Yeah.
so I wasn't planning on it.
Yeah, I can only wants to pull up.
I don't know if you heard me, notice there was no tears, he was just.
Oh, no, I know. He doesn't like rolling on his tummy. He does it himself, but
Oh, suck. Take a good hit. Right, right.
Their shirts say it all. She says,
That? You can talk like she does? Sparkles, ooh. Good job, good job. She's like, when he's done.
oh, that thing is so fun to watch.
Do you see what
I put the, I leave the fan on in her room on low and she'll just lay there. I was like, we don't need a mobile. Watch the fan.
he likes fans too.
Great source of entertainment.
A nice upper quadrant, there we go. Yeah.
There's something called a delayed visual maturation, and it's exactly what you described. Is where you're right in front of him, and he doesn't look at you. You can tell that he's not really seeing you. A lot of kids that have other things going on, they seem to have that, and it resolves itself by 12 months.
Oh, really?
And if it doesn't, then it's called cortical visual impairment. But as fast as he's coming along,
Bless you. Bless you. Whoa, bless you.
and kids can have absolutely normal vision with delayed visual
Really?
maturation. Yeah.
Yeah, see, easier to get my hand, look at this now.
Yeah, see, if you would have done this a month ago, he would just follow your voice. He never would follow anything.
Yeah.
Yeah, but see, look at his neck's coming out now. I didn't believe what she and I can do to eyes in an hour, much less a month. I really don't mind if you want to do that. But if you
And
don't, I'm
because
going
he
to try
can-
one more time.
Because he can go.
Blah, 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 blah.
Because he can go up.
I think the answer is no, I tried 3 times.
Oh
You
my
can
goodness!
swallow
Do we
it,
need a
okay.
noisy thing or something?
You have to hold it for a second and he'll start sucking.
I haven't been doing
This
more
one
than
makes
a
sense.
pop-up toy. So far, do you have any questions?
No, I'm just watching.
Or what I was
You
gonna
guys have
say.
any questions?
Because he's now going up and tracking in the upper quadrants, usually kids with cortical visual impairment are not able to do that.
That makes me happy because we were
You
worried.
see how nicely he's looking now up above his eyes?
Well, he's always looked up above.
Yeah.
It was when he would look at you that you could tell he was just looking right through you.
I don't think they've done many studies on delayed visual maturation. Cortical visual impairment they have, but it's, because it resolves itself, they sort of, I think, figure, what the heck.
Does it seem linked to anything else? Or just, is it linked to anything else? Where it commonly shows
Well,
up with
he's
something?
missing the bottom half of the left side of his brain.
Okay.
It never developed. So they really said
The
it could
bottom
be, it's a matter of what happens with what his head does. They said the brain's kind of individual.
Are you talking about in the back?
Mhm. They said he probably had a stroke in utero and just it quit developing.
Well, that could have been part of it then, why he wasn't seeing it first.
Well, and they told me with the brain, you really can't determine what's gonna be and what's not because everybody's brain works differently.
He does not like me touching his head.
He doesn't like anybody touching his head.
Yeah.
Well, talk to him. Tell him what you think. Yeah.
But again, I want him to know that there's no owies here, so I do try and stay away from it.
Yes, you're doing such a good job, aren't you?
Do you have neurology?
A neurologist,
Yeah.
Board Lodge at
Carolyn.
CH. He rolls, but he doesn't hardly ever hold his head up.
He wasn't able to before.
He usually has it down and he gets really upset because he can't hold it up long enough.
Wow. I noticed that the first time I brought my son to the shop, he couldn't hold his head in the first visit. He held his head.
Really?
That was
Yeah,
Arlie,
see, he's never done it like this. Usually it's for a couple seconds and he drops it.
Notice though, when I first started working with him, again, he's not used to breathing in this position, holding his head. There's a lot seeing in this position. So I bring him back, bring him in, but now he's transitioned. He doesn't know. Babies don't go, wow, I actually didn't enjoy that. Now he's trying to get out of it, so I'm letting him do it. I'd rather go for one brilliant, successful than, come on. Now, if he keeps rolling, like I wasn't expecting to work on rolling today, he did.
He loves to roll, but
Yeah.
he hates when he's in that tummy position because he can't lift his head. And he sits in, his head is in whatever he's on,
Now, he can't roll over onto his belly when he's holding his foot. He's gotta learn that. Okay, let go.
He's never done a complete rollover. He always just goes from back to stomach, back to his back again. And it's mostly to that side.
Just his arm up, just right there. And now I'm kind of just doing a reverse with him what I was doing with Arlie.
What is it that you're doing? Just pressing?
I'll fill you up just so you see. I'm working with the efficiency of the movement in his bones. Most people think it's a muscular base, like he's too weak and that's why he can't do it. No, I showed right from the beginning. He really had no knowledge he had a backbone. He had feet, he had legs, he had arms, he had a
He
head.
just discovered his feet too.
Well, he wasn't able to discover them because the spine wasn't helping out.
And he
So-
does that a lot, where he flares into an airplane.
Yeah. Yeah, but a healthy baby can get in and out of it, an unhealthy baby can't. So what I'm doing here is slowly working with his balance going over to his elbow. Now you can see he's already trying to go into some kind of crawl, but I'm not ready for that just yet.
Yeah, he tries to, that's what he does.
He's tired, but at least now he's fine laying with his head down. See, he knows now he can lift it and unlift it, so now laying on the belly with his head over is not such a threat.
Yeah, he wouldn't do that.
Yeah. So here again, I'm just activating the spine. He's very content.
Now, how come his physical therapist doesn't?
Because they don't do it either, so.
Because she can't get him on his stomach.
Well, most therapists are working on rehabilitation. In other words, you hurt your knee, you go for, see how he's going now, up and down? you hurt your knee, you get knee surgery. You've already walked. That's what they're trained for, rehabilitation. You've walked before, I can talk
He's
you
never
through it.
done it.
He's never done it. So they're not looking at the subtleties of balance and vestibular and counterbalance. So especially with babies, what can get done in an hour to change now his whole development will be huge. But see, now he's learning, see the difference? He's
never
shifting
done
his
this.
weight, yeah.
I spent the entire first like 3
So
times
now-
with him going, she's never done
So
that.
there we go.
Yeah, I was just gonna say, you
And then
agree with
she
that a lot.
does. She would do nothing the rest of the day but eat and
See
sleep
there?
and eat and
See?
sleep.
Because it tires him out so
Because
much.
it's so much.
See, and he
There we
goes
go.
to physical therapy now, and the only reason he sleeps and eats is because he cried
Yeah.
the whole time.
Yep, that's all I hear too. Now, he's such a hard worker, what's he crying about?
And I,
She's
and I
forcing-
say, baby shouldn't
There you
cry
go,
during
there you
anything.
go, you're gonna start
Because
crying.
he doesn't, babies don't learn when they're crying. They don't learn
No, he
anything.
just gets more and more flustered.
Yeah.
There we go.
Wow.
Look at you.
My husband would just cry.
Well, that's why we're recording it,
Yeah.
so he can at least see. Grandma can see too.
Yeah, we moved in with my aunt and my grandparents, because with all his medical bills, we can't afford, we were gonna be homeless,
Right.
so
Have you applied for access to get through DDD?
they
But
didn't ask
yeah.
because my husband works.
Yeah, but I mean, have you gone through early intervention DDD yet?
He just got approved for early intervention,
Okay,
and they've started with them last week.
but you need to go through
Which
the,
agency?
ACT,
Okay.
but you need to go through DDD.
I am.
Okay.
I've had the interview, now I'm waiting for them to come out and see him.
What? What? Is that fun? Yeah,
Well, I
see
can
now,
tell
see
you,
the, see now?
If you come here, he'll,
Well, after
it's
seeing
worth
this, my husband would
100,
be like, I don't
it's
care
worth
what you
100
do, so.
visits. It
But,
really
but
is.
see now independence, how all of his appendages are getting? See now he's coming over on himself, let's see if he'll do it. I'm gonna help him, I'll work with him. The biggest problem is right now his arms stretched down a little bit too low, but I'm just gonna go right here. Or what you can do is just slide him a little bit, and there, see he's right, he has a support now.
Yeah, I wanna cry because he usually just screams.
That's what, she's like, did he just, sorry, I'm saying he because did she just roll over? She goes, you don't understand, that would be a deal breaker. 'Cause she would just scream for like an hour. What?
Does she have anything wrong with her?
We
or
can
is
do
she
that.
just slow-
Do you
slow
wanna then,
or-
is it
No.
better now for you to come over here
Yeah,
now?
now that I
She's
know what he's.
uncomfortable all the time. Arching her back, she's just screaming. and
Because then you
so-
can work on
And then
crawling too.
Okay.
my
I'm not looking
mom's
for
best
crawl, I'm
girlfriend
looking for him to just
comes here.
look and go,
And
you
Michelle
know, look
needed
forward.
a baby to borrow to do the demonstration at the Blind Deaf Coalition.
Arizona Deaf
For us,
Project there.
the Deaf Blind Project. And so I told her she could borrow Arlie for the assessment to just show them what they were talking about doing. And she said she'd give her free lessons for doing it.
Oh, you see Miss
And when we were
Diane?
there,
Oh, there we
um,
go.
it's perfect because she's just uncomfortable.
fun.
And when we were there, we started talking about how there's nothing online to do with your baby. You start looking, what do you do with your 2-month-old who's miserable and screaming all the time in their life? Put her on her
No, no, no,
stomach
no.
for 20 minutes a
There
day.
you go.
Call it tummy
Yeah,
time
that's
and
what they
and
told
put
me.
her to
There we
bed
go.
time. Like, that's not,
There
she's
we
not
go.
doing anything though,
And he
but
would start
screaming.
teasing because he upset himself so much.
And so we started coming to make a series of videos for moms on how to work with their own babies. And just
There we
developmental
go.
things and how to do that stuff. And she became like the happiest baby
That's
ever.
it, that's it. Now the left shoulder just came out for the first time. He's bringing it back, that's fine, but at least he,
My son has epilepsy.
Oh, does he?
there we go, there we go. See
He
now
used to
left
have,
shoulder's
like,
coming out?
ADD, I think. And now he's
About to probably put it back in his back just to give him a break. I don't wanna poop him out.
And that's what I wanna see for him.
I think he's gonna be a bit more like Steven and just keep going. Yep, there he goes again. See, okay, then we'll go on your belly again.
But with his cerebral palsy, I worry. You know, how far will he go?
Yeah.
Oh, if he's, again, mathematically, if he's doing this, we're what, only a half hour into it? I'm not concerned.
Oh, my husband's convinced he'll be just fine. With his
Well, that's the
medicine
parents you
and-
want, and that's how I was with my kid. My son was severely delayed, and the therapies weren't working, so I had to become my own therapist. Went for training, and, but I'm starting to develop my own things.
How old was he when you started doing this?
Graham, 2.5. It was May, and his birthday's in January, so not 2.5, but just,
See, he would never let you do that, because it was like
He
he
didn't
didn't
know
want the
how to
pressure
do
on
it.
his belly.
right, he didn't know how to do it. But see, this is, you'll see from the class we just did with her, because again, you get the comparison. See, look at that, the counterbalance. See how his head's moving, and then it's a little bit weaker on this side, but see how quick he's getting with the counter. That's what we were just working on
Well,
with
just the fact that he's doing it.
It's so fun to watch them unfold.
So I still, notice I'm not forcing the elbow down, he's figuring, but this is also too, he's bringing the left shoulder out. Yeah, I know, it's your left side, that's okay, I'll do it now, I'll do it now.
Is that part of his CP that's causing that?
You know what? I don't go by diagnosis, Diane's much more about, because that's just what she's used to, and you'll do with that with most therapists. I'm looking for efficiency of movement, so when I hear, and there's enough case studies in this work, like there's a girl I know, she's my son's age, she had a right hemispherectomy, so she's missing the right side of her brain. Was supposed to lay there and be a vegetable. And she works with an OGCOM device and a written device, and she walks with assistants, and she's doing marathons with her parents, sort of like the Hoyts. And she's brilliant, and she only has a half a brain. So, her epilepsy was so bad that the only way to stop the seizures was to take out half the brain. So, and there's another very famous case called Elizabeth, and she was missing 1/3 of her brain. And she got married when I was in training. She can drive a car, and she has 2 degrees. So, and she was missing. I look at it with the kids, it's just like the house wasn't complete, so what? But they don't know the difference. Like never having a television. If you don't have it, what's
You don't
missing?
know any different.
They just remap. But you have to get in there and work with what I call developmental movements, these really crucial, the counterbalance, his acceleration.
There we go.
Okay, that's where you want to tuck the head in on this side. So now I'm doing the same thing I did to the other side. So his spine is not lit, there we go. I'm not working on sitting up just yet, but that's what it would look like. Yes. Yeah, that's sitting up. Okay, we're gonna bring it back down. Here we go. Okay, take it. Now he's doing the same thing. What I'm needing to do is to lift the head up. See, now the arm's becoming asymmetrical, one arm up, he's playing with his move.
Getting tired. My son, every time I would lift up, from here, he's about.
There's a little sleepy in there. Just a little bit. He's doing a lot of work. Here since he's just cuddling with me, I'm just working, activating his upper spine a little bit more. Are you getting sleepies? It's okay. If you fall asleep, I can do a lot more work. I really don't mind. But also, do you see how much his eyes are improving?
Mhm.